Okay, so this is diseases of the larynx and pharynx. So we're going to look at laryngeal hemiplegia and dorsal displacement of the soft palate. Okay, I prefer organs. So the larynx, what is it? It's basically the bit between the pharynx. So the pharynx is sort of like the division before the esophagus and the trachea. So the larynx is between the pharynx and the trachea. So imagine the pharynx is like this, and you have the esophagus going this way, you have the trachea going this way. The larynx is the bit going this way, leading to the trachea. And it obviously is involved with breathing, vocalization, deglutition, whatever that is. And the architecture of the larynx is basically made up of cartilage, muscles with the lumen lined by mucous membranes. And you have different types of cartilage: cricoid, thyroid, and epiglottic. I think this is the easiest to remember, maybe this. They're not paired, whereas you have the arytenoid cartilages and attached corniculate processes that are paired. The arytenoid cartilages, they are probably the most active in terms of the laryngeal cartilages, and their movements allow the closure of the glottis during swallowing, which is known as adduction. So if someone asks, that's what it is. And maximal opening during exercise, abduction. So the mucous membrane lines the vocal ligaments and forms lateral ventricles known as saccules. So if someone asks you what saccules are, the mucous membrane that lines the vocal ligaments forming the lateral ventricles. They are about 2.5 centimeters with a capacity of 5 to 6 milliliters. And they're on the medial surface of the thyroid cartilage, so the inside of the thyroid cartilage, and the ventricularis and vocalis muscles. It shows you all the cartilages. I don't know if this is even going to come up, so I think I'll move on. You have the surgical anatomy of the larynx. Let me try and show it to you. So the movement of some of these, let's say, laryngeal cartilages in relation to each other is achieved by you have intrinsic laryngeal muscles, whereas the movement or stabilization of the larynx is from extrinsic laryngeal muscles. So just to be clear, the intrinsic ones allows the movement of the laryngeal muscles, whereas the extrinsic ones, the movement or the stabilization of the larynx is done by these. So if they ask you examples of intrinsic ones, you have cricoarythenoides dorsalis. I'll just show you them. Thyroarythenoid, just remember the names of the cartilages. That will help. With the extrinsic, it's a bit similar, but it's more about the muscles, like thyrohyoideus, hyperepiglotticus. Hard to remember and hard to read. So the muscle, the CAD muscle that's saying, so I think this is the cricoarytenoideus, is the major abductor muscle, so that widens the larynx when the horse is exercising, and also mechanically tenses the vocal folds. And you also have something called recurrent laryngeal neuropathy or laryngeal hemiplegia, which we mentioned at the very start but haven't really defined yet. So what is it? I'm just trying to move this. So this is where you get over time loss of large myelinated axons in the left laryngeal nerve. So what you get is neurogenic atrophy of the intrinsic laryngeal musculature. So you get atrophy of these laryngeal muscles, which, as we said, is responsible for the movement of the cartilages, particularly the CAD muscles, and this leads to dysfunction of the associated arytenoid cartilage. So so the main issue is here, cricoarythenoideus. So it usually occurs in horses after a few months of age to 10 years of age or older. So really any horse, especially large breed horses such as thoroughbreds or draft breeds like this one. It can occur in any horse, any age. So how is it caused? I think I'll stop here.